What's up, guys? My name's Arjan Hura. I'm currently a Chief Ophthalmology resident at the University of Cincinnati in Cincinnati, Ohio. I wanted to make this video because I recently underwent the fellowship match process, and at the top of the cycle, I found myself with a lot of questions, but not really a good group of cohesive resources to turn to in terms of getting those questions answered. My hope is that by the end of this video, you'll 1, have a better feel of what's the right type of fellowship for you, and 2, I'll try and provide you with some resources that will hopefully aid you in your own personal fellowship search. The first thing I would say is really take the time during intern year, take the time during PGY2, PGY3, take the time during those first 3 years of your ophthalmology residency training to really thoroughly consider and vet all of the different subspecialty options that we have in ophthalmology. We have lots and lots of different fellowships. You want to make sure that when you enter PGY4 that you're really committed to a certain fellowship. You're not on the fence between multiple fellowships. Now, if you don't want to do a fellowship or you realize you love everything in ophthalmology, you want to be able to take care of patients in your community, empower them, you want to improve their lives, help correct their vision, but you want to be able to do everything you feel comfortable doing without having to do a fellowship, that's awesome. By all means, go ahead and do that. Get out into the community, start serving patients. I think that's fantastic. I think comprehensive ophthalmology and general practice is an extremely rewarding career path, and if that's what you want to do, by all means, do it. Sometimes you may not have the luxury of pursuing a fellowship year. Maybe you have a spouse or significant other, or maybe you have kids or a family you need to support, and you just can't take an extra year of training on a resident to fellow salary to get that extra training while still taking care of your family. I totally get that. But if you're someone who wants that extra subspecialty training, if you want a little bit of that extra edge, if you have the luxury of taking a year or two to do a fellowship, then definitely make sure you're fully committed to what you want to do, because when you enter PGY4, when you start deciding to apply for fellowship, you want to make sure that you're full steam ahead and you don't have any second thoughts or regrets about what you're choosing to do with the rest of your life. Now, you don't just have to choose one area. If you're on the fence between a couple fellowships, you can do 2 or sometimes even 3 fellowships. There's plenty of people out in our field who've done that. There are people who've done a retina fellowship and then done an ocular oncology fellowship, or done a retina fellowship and a uveitis fellowship, neuro-ophthalmology and oculoplastics, or pediatric ophthalmology and neuro-ophthalmology. There are even people who've done a pure traditional academic cornea fellowship and then gone on to do a pure refractive type fellowship. The world is your oyster. You can make as many different combinations as you'd like. Just make sure that when you're deciding to do the fellowship year, you've thoroughly vetted everything and you have a good feel for what all of the subspecialty options offer in ophthalmology. You've made it this far in your academic career path. The last thing you want to do is get into a fellowship and realize, glaucoma's not really for me, or, oh, hey, I don't really like kids. I don't want to do pediatric ophthalmology. And again, I just want to reiterate, if you want to go into general practice, if you want to be a comprehensive ophthalmologist, by all means do that. That's what residency trains us to do. That's what residency prepares us to do. It prepares us to be comprehensive ophthalmologists who cover all different subspecialties within the eye, and it enables us to do as much as we're comfortable doing to take care of patients in our community. So you definitely don't have to do a fellowship to have a satisfying, to have a fulfilling career. Now, in general, when pursuing any kind of fellowship or looking for a job, people usually consider the same types of things: location, surgical volume, is it a private practice or academic environment, are you close to your family, are you close to a significant other or spouse? Those are all sort of the things that most people consider. That's not what I want to focus on. In this video, I want to focus on what specifically delineates a traditional pure academic cornea fellowship from a cornea and refractive hybrid fellowship, from an anterior segment fellowship, and from a refractive fellowship. That's what I want to focus on here. The first type of fellowship we'll discuss is the traditional pure academic cornea fellowship. And what I mean by that is, this is the kind of fellowship that is the natural progression for most residents. You've spent 4 years of undergrad, you've spent 4 years in medical school, you did 4 years of ophthalmology residency. All of that training was done in the academic environment. So this kind of fellowship, you don't need to second guess what you're getting yourself into. This is the natural progression. You've worked with fellows in residency, maybe even as a medical student. You're going to be one of those fellows if you decide to pursue this kind of fellowship. The majority of these fellowships are at academic institutions, although there are a few that are at private practices. So when you're in the academic environment, that means you may have your own fellow clinic, you'll probably be working with attendings in their clinic, you might be staffing residents in their own clinics, maybe even staffing some cataract surgeries with them, and in general, you'll be taking some combination of general, trauma, and cornea call. So you might be getting calls from the chief residents or the primary resident on call. If a corneal ulcer comes in the middle of the night that's perforated, or there's some other type of corneal pathology that they really just want your input on, and you'll definitely be staffing open globes with the senior residents when those come in when you are on call. So that's to be expected regardless of whether you do a cornea fellowship at a private practice or an academic institution. In addition to that, you will likely be expected to do 1 or 2 grand round presentations throughout the entire year. You'll likely have to prepare an OCAPS didactic review session for the residents, and it's largely expected that you will be working on some type of research project throughout the year. Most of these programs will pay for you to go to AAO or ASCRS or some other meeting if your work gets accepted for presentation. These programs will also usually help fund your travel to the annual Cornea Summit for the fellows, so that's a nice chance to meet and network with all the other cornea fellows in the country. In terms of what you're going to be learning, this is everything you expected of cornea when you were going through a residency. So you're going to be seeing really sick eyes with corneal pathology. You'll be taking care of corneal ulcers, corneal dystrophies. On the surgical side of things, you'll learn how to do corneal transplants. So you'll learn how to do penetrating keratoplasties, DSEC, DMEC, DALK. You might be doing ocular surface reconstruction with amniotic membranes. Some of these fellowships will get you involved with complex anterior segment reconstruction. You might find yourself doing limbal stem cell transplants. There's a wide variety of anterior segment experience at some of these fellowships, although they may not be as high on the cataract or refractive end than what you might be used to in residency training. What I mean by that is the majority of these fellowships, you'll still get to do cataracts as the primary surgeon, but whereas in residency you may have done 120, 150, all the way up to 350 or 400 cataracts as the primary surgeon, in these fellowships, you'll likely only be doing anywhere from 20 to 40, sometimes up to 70 cataracts. That's for the majority of these fellowships. There are some where you do up to 200 or 250, but that's certainly not the norm. These cataracts may not be the simple, straightforward cases because those usually will go to the residents who are still learning how to do cataract surgery. You'll likely get to do the more complex cataracts, or if you didn't get to operate on monocular patients in residency, you may get to operate on those type of patients as well. So you will still get some cataract experience to keep honing your skills. You're not going to forget how to do cataract surgery, but the focus of your training throughout this year is going to be on cornea and external disease. If you're really interested in going into academics, if you know you want to work at an academic institution, then this might be the perfect fellowship for you. If you do an academic cornea fellowship, that doesn't mean you have to go into academics. You can certainly go into private practice as well, but the network you'll have with your mentors, with the faculty, the connections they'll have, that can really help you in terms of finding an academic position at an institution. You will be fully trained in the medical and surgical aspects of cornea and external disease, so even if you don't want to go into academics, you can certainly go into private practice as well. What makes this fellowship a little bit different from the other fellowships we're going to discuss is most of these fellowships do not have a significant component of their curriculum dedicated to refractive surgery. You might be exposed to a little bit of LASIK or PRK. You may even get to do 1 or 2 of those procedures on your own, but the majority of these fellowships, that's not really the case. The second category of fellowships are what I like to call the hybrid fellowships. What I mean by that is they're a combination of cornea and refractive surgery. So whereas in the traditional cornea fellowship, you didn't really have a lot of exposure to refractive surgery, in these kind of fellowships, you will get exposed to that. Now, that level of exposure really depends on the kind of fellowship. Some of these fellowships, you may be on a refractive surgery service or rotation for 1 month. You might be on that service for 2 or 3 months out of the year, maybe even 4 or 5 or 6 months. It really just depends on that kind of fellowship. You will likely get exposed to LASIK, PRK, some of these fellowships you may even be exposed to SMILE, but you won't necessarily be exposed to the entire refractive surgery armamentarium. Just be prepared for that if you're someone who wants to learn every type of refractive surgery procedure out there. This might not be the type of fellowship for you. You may get some exposure as the primary surgeon doing some of these surgeries, but likely a lot of this is going to be observational, meaning you'll walk through every patient with your attending. You'll go through that preoperative process of patient selection, of biometry measurements, of looking at the other imaging modalities that exist in refractive surgery. You might not be the one doing the surgery, but you'll at least get to go through that and have an understanding of how to pick the right patient for the right procedure. Some of these programs, when you're doing the surgery, for example, let's take LASIK, you may make the LASIK flat, maybe you only do half of the procedure. Again, it really just depends. Another thing that's important to note is some of these fellowships, as the fellow, you are expected to recruit your own patients. And depending on where this fellowship is in the country, what the patient population around you is like, what time of the year it is, how the economy is doing, that might be easier said than done. Some of these fellowships, there's a long backlog of patients already waiting for the fellow because these people, these patients or these faculty or staff who might be in other areas of medicine, they know that the fellow does discounted refractive surgery under the guidance of the refractive surgeon attending. And so they're all gung-ho about getting their surgery done. And as the fellow at these kind of programs, you might not have to do a lot of patient recruitment. That's just something to be aware of. If you're someone who wants that cornea training, but you also want some exposure to refractive surgery, this might be the perfect fellowship for you. If you're looking for a truly comprehensive training in refractive surgery, this might not be the best fellowship option for you, but if you want some exposure to refractive surgery, if you want to learn how to do LASIK, PRK, and learn the basics while also taking care of corneal pathology, then this might be right up your alley. Most of these fellowships, the fellow will do anywhere from 20 to 40 primary refractive surgeries, although sometimes that can be up to as high as 70 as well. Again, what does that definition of being the primary surgeon mean? It really just depends on the program. Do your due diligence, reach out to the current fellow either during your interview or outside of the match. Ask them what their experience is like because they're really the ones who know best what that program has to offer. And this goes for all of the programs, regardless of whether they're pure traditional academic cornea, this cornea refractive hybrid, anterior segment, or refractive. Utilize the SF Match to look at the program descriptions, go to the program's individual websites, do your homework before the interview or before reaching out to the faculty members or current fellow to figure out exactly what that program has to offer. If you have a certain practice in mind or you have a certain area of the country in mind before you decide to submit that rank list, reach out to those practices to see exactly what they're looking for. I know of certain situations where a place might be looking to hire someone who has a more traditional pure cornea background as opposed to someone who's done a hybrid fellowship. That's certainly not the case in all instances, but just make sure you do your due diligence so you're not caught off guard because you had your hopes and dreams set on a certain place or a certain practice and you realize that your training might not be exactly what they're looking for. The third category of fellowship I want to talk about are the anterior segment fellowships. Now, these programs, again, are pretty diverse in terms of what they offer. Some of these programs will be very glaucoma heavy, some might be heavier on cornea. What I mean by that is some of these programs you'll get to do a lot of MIG surgery, you might be doing tubes and trabs, whereas other programs might be much more heavier on corneal transplantation where you'll do DMEC, DSEC, DALK, PKPs. In some of these fellowships, you get to do everything. And so if you're someone who really you decide you don't want to be a retina surgeon, you don't want to do pediatrics, oculoplastics, neuro-ophthalmology, but you want to do everything else in the anterior segment space, this might be the perfect fellowship for you. There's not too many of the fellowships out there like this. Most of them are in the private practice setting, although a few are at academic institutions as well. You really just need to do your homework after you register for the match, look through the SF Match website, look at the program descriptions, figure out whether this is the right type of fellowship for you. The final category of fellowship I want to talk about are the pure refractive surgery fellowships. And out of all of the fellowship options we've discussed so far, the traditional academic cornea fellowships, the hybrids, the anterior segment fellowships, this category of fellowship is definitely the most new. It's only over the past several years that more and more of these fellowships have been created because there's been a growing awareness in the ophthalmic community that the majority of the traditional residency curriculum does not expose residents to refractive surgery in a comprehensive or, in most cases, even a superficial manner. There was a growing need that was identified by current refractive surgeons that there needs to be some formal training developed to prepare the next generation of ophthalmologists for refractive surgery. So these kind of fellowships exist as of now exclusively at private practices. You'll work one-on-one with maybe one or two attending surgeons. You'll do lots of cataract surgery. You might do femtosecond laser-assisted cataract surgery. You'll do refractive lens exchange. You'll do likely the full spectrum of laser vision correction. You'll do LASIK, SMILE, PRK, and all of its variants. You might be doing corneal inlays or doing other presbyopic vision correction type procedures. You'll get exposed to all types of refractive surgery. So after you come out of this fellowship, if a patient approaches you, they want to be glasses free, they want to be contact lens free, or they just want the creme de la creme, they want premium refractive surgery outcomes, you'll be able to help those patients with this kind of training. What also makes these fellowships unique is that they train you in the business and administrative aspects of ophthalmology. Again, areas that most residents aren't really well trained in during residency. So if you're the kind of person you want to go into solo practice or you want to create your own practice, you will have the knowledge base and the skill set to do that coming out of these fellowships. Or maybe you want to join a pre-existing private practice and you want to build a refractive surgery presence there. You can definitely do that as well. Or maybe you just want to join a practice and have a very well-run service. You want to establish a good culture amongst the technicians, your staff members, all of the surgeons there. You just want to really develop a premium environment for patients to come in and have vision correction. You'll get to learn how to do that at these fellowships. Something else that's sometimes unique to these fellowships is these practices are usually very involved in clinical trials. They're involved in the latest FDA clinical studies. They're on the cutting edge of technology. So if you're someone who loves technology, you want to be involved with the latest and greatest, oftentimes you'll get your hands on the latest technologies or the latest IOLs or the latest options for vision correction before maybe a lot of other ophthalmologists in the community or at other private practices. So if you're someone who's really interested in working with industry or collaborating with others on translational or clinical research, this might be the right program for you. If you're looking for becoming a really well-trained cornea surgeon, if you want to treat cornea and external disease, if you want to do corneal transplants, these are not the kind of fellowships for you. You will likely not be learning how to do any of that at these fellowships. But if you really want to be very well-trained in refractive surgery, in cataract surgery, in anterior segment surgery, if you want to learn how to deliver premium refractive outcomes, this might be the perfect fit for you. So again, we've talked about the SF Match website. We've talked about individual program options in terms of their descriptions on the website. Those are all must-dos. Talking to the current fellows, that's a must-do for any program you're interested in. Really talking to the faculty on interview day, this is when it becomes super important when they ask you, what questions do you have for us? We all got asked that for residency interviews. Every single person asked that. You know, how many questions can you come up with that are unique? I get it. But this is really important for fellowship interviews because unlike residency where you might have had 1 or 2 or 3 or even 4 other co-residents, where you might have had many faculty members you work with throughout those 4 years, in fellowship you might just be the only fellow there. You might only have one attending mentor you're working with. So it's super important you understand what you're getting yourself into, that you understand what the program has to offer, and that the program understands what it is you're looking for. The program is going to be totally honest with you. The faculty members are going to be honest with you because they want the right fit. They want the right match. You want your interests to align. You want it to be a synergistic, mutual relationship that is a positive thing for both parties involved. It's really important that you get along with the people you're interviewing with. It's really important that you get along with the kind of fellows that have matched there before, because those are likely the kind of personalities they're looking for in their next fellow as well. Why is this so important? Again, because you're going to spend an entire year or sometimes 2 working in a one-on-one setting, working very closely with them. And you can go to the most well-respected program in the country. You can go to the most prestigious academic institution. You can work with the greatest minds in ophthalmology that have received the most awards, the most accolades, who are doing the most cutting-edge research. You can go to a program that has the highest surgical volume, but if you don't get along with your mentors, if you're not on that same wavelength, if you don't share the same energy, that conduit of information transfer is going to be suboptimal, and you're not going to make the most out of that experience. So I really encourage you, everyone has different things they're looking for in fellowship. Make sure that the programs that you're going to be ranking highly not only have what you're looking for, but that you really get along with the people there as well. I think that's just as important as all of the other discrete and objective information that you might be considering. So in addition to perusing the SF Match website, the program websites, talking to the current fellows, talking to the current faculty members, you may love it, you may hate it, but Student Doctor Network, SDN, is actually a really great resource for looking through several years of past cycles, seeing what the applicants were talking about at that time. There might be a lot of information about surgical volume or about the experience that former fellows have had at some of the fellowships you might be interested in. And at the very least, every year people will go through and they'll post when certain programs have sent out fellowship invites. So if you're trying to come up with your calendar for predicting when certain fellowship invites are going to come in, or you're trying to create your fellowship interview schedule, that can be a good resource for that as well. Finally, one of the last resources that's really new, and I'm kind of jealous of because I didn't have access to this when I was going through the process, is a new platform called Young MD Connect. And this is a platform that really prioritizes networking, mentorship, and a database for private practice and academic fellowships. This platform was born out of multiple brainstorming sessions with medical students, residents, fellows, young ophthalmologists to identify what are some of the things that they felt are lacking in training? What are some resources that they wish they had that don't currently exist? And across the board, unanimously, the things that were identified were networking opportunities, mentorship options, and learning more about fellowship programs. And so this platform addresses all of that. Full disclosure, I am one of the beta testers for this program. I think it's going to be a fantastic opportunity for people to interact with their peers, colleagues already well established in the field. And a lot of these people that you might have mentorship sessions with, a lot of these people you'll be interacting with, they're the ones who are fellowship directors. They have their own fellowships at academic institutions. They have their own fellowships at private practice. So if you're looking to interact with them outside of maybe the traditional meeting environment or outside of the traditional fellowship application process, this might be a good way to meet them and get your name out there and learn more about their program on a much more intimate level. I think this is going to be a fantastic option in addition to everything else we've discussed. Again, if you're interested in it, it's called Young MD Connect. Feel free to reach out to me for more information. I'm happy to discuss this at length as well. All right, guys, that's it. So if you found this video helpful, let me know in the comments below. I'm happy to address any of these fellowship options in more detail. I'm happy to make videos about other fellowships, or if you're just curious about how to go about residency, figuring out, are you interested in doing a fellowship in the first place? Do you want to just go into comprehensive practice? I can make videos about anything you guys might be interested in. We can talk more about refractive surgery. Just let me know what you're interested in, and I'll be sure to make a video for that. In the meantime, best of luck in your own personal fellowship search. Best of luck with the future if you decide not to do a fellowship and you go into practice. Stay safe, and I'll see you next time.